Hello everyone. So in this video on the series of obstetric lecture, today we will be discussing about recurrent miscarriage. So the recurrent miscarriage is defined as the sequence of two or more than two spontaneous abortion documented either by sonography or on histopathology before 20 weeks of gestation. And this definition is as per ASRM, that is American Society for Reproductive Medicine 2013. However, earlier definition given by RCOG stated that 3 or more miscarriages before 24 weeks of gestation. So this is now updated definition: more than two spontaneous abortion, less than 20 weeks. And and talking about etiology of the uh, uh, um, recurrent abortion, the recurrent miscarriage is one of the distressing problem, and it is affecting approximately 1% of all women of reproductive age, and this risk increases with each successive abortion, reaching over to 30% after 3 consecutive loss. So in first trimester, the causes of recurrent abortion are complex, and more often they are not found, and the parental chromosomal abnormalities are one of the most common cause for peri-implantation as well as the early pregnancy loss. So that's why the genetic factor constitutes the one of the parental chromosomal abnormality is a proven cause for recurrent miscarriage. The most common abnormality is balanced translocation. The risk of miscarriage in the couple with balanced translocation is greater than 25%. However, the chance of a successful pregnancy even without treatment is 40 to 50%. And other less common findings are chromosome insertion, deletion, inversion. The most common aneuploidy found are trisomies, and the trisomic miscarriage does not increase the risk in next pregnancy. And so the balanced translocation is most common. And the next one is endocrine and metabolic factor. The first is poorly controlled diabetic parents do have an increased incidence of early pregnancy failure. The presence of thyroid autoantibodies is often associated with increased risk. The untreated hypothyroidism increases the risk of miscarriage. Women who had been euthyroid before pregnancy. The luteal phase defect with less production of progesterone is too often related, but whether the diminished pregnancy level, progesterone level is the cause or effect is really not clear. So this is luteal phase defect. And the polycystic ovarian syndrome, the exact mechanism of increased miscarriage is not known here, but beside elevated luteinizing hormone level, other factors responsible are insulin resistant hyperinsulinemia and hyperandrogenemia or hyperhomocystinemia. These may cause miscarriage in PCOS. And next one is hyperprolactinemia, an association by competing with hypothalamo-pituitary ovarian axis resulting insufficient folliculogenesis, oocyte maturation, and LPD, luteal phase defect, the dopamine. This can cause the recurrent abortion in hyperprolactinemia. And then we have the infection. The infection with bacterial vaginosin is a risk factor, and no infection have clearly been linked to recurrent miscarriage. And we have the next in inherited or acquired thrombophilia. They with hypercoagulable state to cause varus arterial thrombosis. Inherited thrombophilia causes both early and late miscarriages due to intravascular spiral artery and placental intervillous thrombosis. The protein C resistant, that is factor 5 lead-in mutation, is the most common cause. The protein C is the natural inhibitor of coagulation. The other factors are deficiency of protein C, protein S, and antithrombin 3, hyperhomocystinemia, and prothrombin gene mutation are also known cause for recurrent miscarriage. Another we have the various immunity factor. The presence of autoimmunity causes the rejection of early pregnancy in the second trimester mainly. The antibodies are anti-nuclear antibodies, anti-DNA antibodies, that is double or single stranded, and anti-phospholipid antibodies. Anti-phospholipid antibody women demonstrate a tendency to miscarry at progressively lower gestation age. Anti-phospholipid antibodies are lupus anticoagulant, anti-cardiolipin antibodies, and anti-beta glycoprotein 1. The cause for miscarriage in this autoimmunities are due to inhibition of trophoblast proliferation and function, release of local inflammatory mediator cytokine through complement pathway, spiral artery and placental intervillous thrombosis, and residual vasculopathy with fibrinoid necrosis. And other cause are unexplained in majority of cases. The cause is unknown. And the causes for second trimester pregnancy loss or recurrent abortion are: one, we have the anatomical abnormalities, the congenital. They are responsible for 10 to 15% case. They may be either congenital or acquired. Congenital anomalies may be due to the defect in Mullerian duct, fusion or resorption. Example are unicornuate, bicornuate, septate or double arcuate. They are due to Mullerian duct fusion or resorption. The congenital cervical incompetence is rare. The acquired anomalies are intrauterine adhesion, uterine fibroid and endometriosis. The cervical incompetence and also some cervical incompetence. The pathology of abortion has been we will see the pathogenesis of abortion in the cervical incompetence later. And so what happens is that due to defective Mullerian fusion such as double uterus, septate or bicornuate uterus, the association is about 12% cases of recurrent abortion. Abortion tend to recur beyond 12 weeks and the successive pregnancy are carried longer. Implantation on the septum due to defective placentation. The diagnosis is confirmed either by ultrasonography or hysterography, MRI, hysteroscopy combined with laparoscopy in non-pregnant female. So that was all. And next other cause is chronic maternal illness such as uncontrolled diabetes with atherosclerotic changes, hemoglobinopathies, chronic renal disease, inflammatory disease, systemic lupus erythematosus. And next one is infection by syphilis, toxoplasmosis and listeriosis. They are responsible in some cases. And finally we have the unexplained, that is we don't know the cause. So that was all about causes of recurrent abortion. Now we will discuss about cervical incompetence in next video. Thank you.